Hello, I'm Roshan, and for my sports injury webinar, I'm going to focus on patella dislocations. Before we get into the injury, let's talk about what the patella is. The patella is a thick sesamoid bone which is circular triangular in shape. As the patella is a sesamoid bone, it sits by itself surrounded by tendons and ligaments. The patella acts as a protection to the anterior part of the knee joint and connects the muscles to the tibia. A more common name for the patella is the kneecap. To understand the patella dislocation injury, we need to know that the patella slides in a V-shaped groove known as the patellofemoral groove. When dislocated, the patella moves out of this groove. The most common way to dislocate it is towards the lateral side. However, it can also happen towards the medial side. A dislocated patella injury looks like this. As a result of the dislocation of the patella, the main ligament connected to the patella normally gets torn. This ligament is also referred to as the medial patellofemoral ligament. Moreover, it also stretches the medial ligament and most or sometimes all tendons involved in keeping the patella in place. There are different ways you can pop your knee or dislocate patella. Most common dislocations occur due to sudden twists in the knee or due to a direct hit in the knee. This is why patella dislocations are common among people who play sports such as soccer, hockey, or gymnastics. Recurring patella dislocations are also common among athletes. When an athlete dislocates his or her patella, they will experience pain in the anterior side of the knee. There will also be stiffness and swelling in the knee area where the injury took place. In addition to this, creaking or cracking noises occur in place of movement. The patella also appears unstable and you can feel it moving inside the knee. Unless the injury results in loose bones or cartilage floating around the knee, or in first-time dislocation cases, it can be treated without surgery. It can be treated through immobilization, where no stress or weight is put on the knee, and through physiotherapy exercises that mostly involve normalizing the range of motion and strengthening the knee. The recovery period may take 6 to 8 weeks. To treat a patella dislocation, it first needs to be popped back into place by a medical professional, followed by icing the swelled area and doing the following physiotherapy exercises. The first exercise is the isometric quadricep contraction exercise. You start by sitting down on a flat surface and extending your legs. Roll up a towel and place it a bit above your knee. Then you push down your knee. Hold it for about 3 seconds, release, and repeat. The next exercise is the leg extension exercise. You sit at the edge of a chair or table tall enough to allow your legs to hang freely. Start by extending your leg to make it straight and then bring your leg slowly back to its normal position and repeat. The last exercise to be done is the quadriceps stretch exercise. Grab the distal end of your foot and bring your heel towards the butt until you can feel the quad muscle stretching. Hold for a few seconds and then release. All the above-mentioned exercises help in strengthening the knee and the quad muscles. To work on your range, a stationary bike could be used, but it's important to know that you should only start using the stationary bike once you are able to move your knee joint without pain. Athletes are cleared to get back into sport once they've gained back the strength and full function of the patella. This is because once you've dislocated your patella, it is more likely for it to happen again. Thank you for listening and stay safe.